Hello, everybody. Thank you for joining us for this WHO CED COVID-19 webinar on decontamination and disinfection of critical COVID-19 equipment, health workers, and patients. We're delighted to have an opportunity to share the expertise of speakers around the globe and invite your comments throughout the session in the chat box. My name is Elliot Sloan. One of the activities I was involved with in the 90s in the peak of the HIV pandemic was manufacturing of medical beds and the cleaning and disinfection of those beds between patient uses, which gave me a very direct access and involvement with this very complex topic. I'm accompanied by co-chair Kathy Wareeye, who is an expert in this field, and she and I have worked together in several settings. Kathy, say a few words, and then we'll move on to introduce Adriana Velasquez at WHO.
Thanks, Elliot. I just wanted to say that from an infection prevention perspective, typically engineering and infection prevention spend their days in separate silos, and how much we appreciate the opportunity to come together in a holistic way to create resources and hopefully solutions to this challenge that we're all facing. And so with that, I'd like to turn it over to Adriana Velasquez.
Thank you for the invitation, for participating today in this very important session. Disinfection, decontamination, sterilization is a huge issue now during COVID. Next slide, please. So WHO has been working on this. As you all know, as of yesterday, there were about 13 million diagnosed cases of COVID, and we have about 500,000 of deaths reported in the last 170 days. So how can we help? And as you see in this map, mostly all of the countries have had COVID infections. Some are really in a bad condition, some are doing better, but it's our great responsibility from us biomedical engineers, clinical doctors, and all healthcare workers to target this problem. Next slide, please. Okay, medical devices, as you know, are indispensable to test, treat patients, and protect healthcare workers. As you can see in this slide, here you have all the medical devices that are required for ICU, also for the laboratory, and all the personal protective equipment. So these are the three big areas in which we have to work. Next, please. This slide I made for you. We have on the first hexagon the number of cases and a global map that talks about the epidemiology. We need, on the blue part, doing health technology management. We need to do needs assessment. We have to ensure the supply and the safe use of the devices. On the purple part is we have to select those priority devices. The patient, as you can see, is in the middle. So we all have to focus really on the patient. Do not forget that. We have to develop research and development. That's on the right side, looking to the technology access pool. We have to see the regulatory aspects. We have to see the innovation, and the goal is at the very end that we can laugh and be happy and hug ourselves again somewhere in the near future. Next slide. Okay, we have three different aspects concerning cleaning and disinfection. First of all, that medical equipment, like capital equipment that is used for COVID patients, for example, in the ICU. The other one is on the reusable items, like it's not a capital equipment. And the third one is non-COVID, but it is non-COVID related equipment that also has to be disinfected. Over. Next slide, please. So we are developing, as you know, technical specifications for procurement of all these medical devices, and they all contain a section about decontamination and cleaning. Right now, we are releasing one for PSA plants, for ventilators, and we are now in the development of some for X-rays, ultrasounds, and CT scanners. They will be available hopefully next week. We're really running through these. Next slide, please. As WHO needs to disseminate information, we have done the what is called the two very important issues. One is the World Health Academy, and the other is the Open WHA. And this is information for healthcare workers. It is all for free and is available in many languages. Next. As you can see, this is the open WHO. You can all find it very easily. You can use it in your laptop, in a mobile phone, and it contains many courses, and many of them are dedicated to infection prevention control. Next. This is the one for the app. Next, on the WHO Academy, and then you can even get credits for that. Recently, there have been 2 new guidelines, and that is for cleaning and disinfection of surfaces. And for that, please know that it is sodium hypochlorite, or that may be used as a recommended concentration from 0.1 to parts per million, and the alcohol from 70% to 90% to surface disinfection. All the guidelines for how to disinfect, how to clean, they're in these documents, but it is very important that this is followed. And the big issue not to do is spraying. Spraying is totally needs to be avoided, because that's the way we are spreading the virus when it is found. So everything should be cleaned either through a cleaning or with a cleaning damp cloth. Next. Okay, we have 2 courses. One is called Decontamination and Sterilization of Medical Devices. The other is called Standard Precautions, Environmental Cleaning and Disinfection. They are all available in the Open WHO. It takes about 1 hour, and then you can go through the whole course, and it helps you how to assess and clean and disinfect different types of devices. It was not done specifically for COVID. It was repurposed from COVID, for COVID. Over. Next. This is the one for decontamination and sterilization of medical devices that is based on that was published by PAHO a few years ago. Next. Next slide, please. And this is the one for environmental cleaning and disinfection. Next, please. This is guidelines for acute respiratory treatment facilities guidance, and that includes the ventilation, how to manage negative pressure, positive pressure, and what to do in intensive care units. And these are especially for treatment centers that are done like especially or on purpose. That means like in special places like immigrations or where we have a very low resource settings, and they are made out deliberately for treating patients. Next, please. Even the Atomic Energy Agency is helping on saying, well, if you have, and this I put as an example, if you're bringing a patient into nuclear medicine, because of course COVID patients, they can also suffer from other diseases. And then if you put a patient into an X-ray, into a CT, and then use nuclear medicine, how to clean the rooms, what process to follow, and this is a good example. This is a book by the Atomic Energy Agency. Next. So we released a book, a guidance. All these are new guidance. This was released talking about cleaning and disinfecting environmental surfaces for COVID. And next, please. And this actually has a table that says which is the patient areas, what is the frequency, how soon you have to clean them, and then what is the available guidance. So this table is really important for healthcare workers to know how fast should you clean the different areas in a hospital. Next. And then we are, as you saw, that we're working on a pulse oximeters, patient monitors, oxygen cylinders, high flow nasal cannulas, mechanical ventilators. And we're developing a full set of training documents and video films. So it is about how to select those devices. Secondly is how to set the equipment for the clinical people to use it. The third is the clinical component, how to use those equipments. But the fourth is specifically on decontamination of those medical supplies. And that is being developed by Kai Long, that is the WHO consultant. He's now in his clinical setting, so he cannot come be with us. But we're working with that and with other WHO consultants and experts panel. Then the maintenance of the equipment and the decommissioning of the equipment. We hope we will start filming. All the video scripts are being done now. We will start filming 1st of August. We hope to have all these videos ready by the end of August. Next slide, please. I think it will be the last one. Yes, and I always use my slides. You might have seen them very many times, but it is just to remember that a patient, and in this case also a healthcare worker, is at the end of all our activities, and they deserve that we all work together with passion and with our technical knowledge to help them go through these difficult times. So thank you very much. And battery problems. Thank you.
Adriana, thank you so much for your incredible leadership and ongoing support for everything that we're doing, and we appreciate you joining us today. You are tireless in fighting all of these battles on behalf of the peoples of the world. Have a great day.